Diarrhea, pneumonia, or respiratory linkage, where is that? Actually, this part is not that well described in the traditional text and literatures throughout the globe, even in the West. Diarrhea is still the killing disease. It is responsible for the 8 to 10% of under 5 death, and pneumonia is responsible for 15 to 20% of the under 5 death. So thereby, knowing this part is essential. What is the relation? Most of the diarrhegenic viruses, rota, adeno, and then other viruses, norovirus and others, they have respiratory linkage. They have concomitant respiratory involvement infections in the throat, in the chest, adenotonsillitis, pharyngitis, and pneumonitis. Maybe concomitant asthma, which is there. So they have to be looked upon in every child with diarrhea. Parents see the diarrhea, loose stools. Look, doctor, my daughter's son, she is having or he is having the your loose water stool. At the same time, then you see they whether ask about the history of cough, and you see the throat, you see the respiratory rate, you count the you see oscillate the chest. So most of the time, I think 90%, even more, will have some of the lung funding and treat them, and then you treat the pneumonia with an oral antibiotic. Then who is with a bronchodilator? Otherwise, you won't be able to cure the child incomplete. At times, the child do not go into diarrhea remission until you handle these cases. So, effective treatment of these two conditions, diarrhea and pneumonia, in children, especially under two, usually is very effective because these two are the source of death in 25% of cases under 5 death. So to reduce the death of these children, you need to look at both the cases and vaccinations, rota, then and your Colbex, your cholera and then ETEC vaccine for diarrhea, and the pneumococcal vaccines, your influenza vaccines, other vaccines, respiratory hep vaccines, meningococcus vaccine, even they take care of this part. So hygiene is important, and taking care and treating both together is important.